Hey folks, Rob Haddo here, and I just want to talk a little bit on evidence-based practice and troubleshooting. I recently read a post by Adam Meekins on acupuncture, basically the summary, a bunch of little pricks, describing that acupuncture doesn't work the way that we think it does, and that in gross studies and overall approach, that acupuncture has no real different validity than sham treatment. And I'm seeing that people are taking that with some umbrage. They're interpreting that as meaning that you should never use acupuncture. We aren't working with gross populace, we're working with persons. Working with one person at a time, ideally. And so when you're working with one person at a time, when you're troubleshooting, it isn't necessarily about the gross evidence. The gross evidence provides an outline for us as to what we may or may not state or claim, or what we may or may not assume to be a case to help narrow down an index of suspicion. But when we're working with a single person, we're troubleshooting to try to address whatever dysfunction they come in with. And I hate the word dysfunction because there are so many people who have bastardized it to mean take my approach for all dysfunction, or fix frozen shoulder in one treatment with my approach. It comes from this dysfunction. Let's use dysfunction very reasonably here. Just a person's perception of dysfunction, what they're coming to you for. And we're troubleshooting that. And so if that patient has validity from a treatment that isn't necessarily backed by evidence for a population, it's still valid for them. It's still usable. It's still valuable. If that patient finds no validity in that, we move on. And so our troubleshooting approach is informed by evidence, it's based on evidence, but it's not shackled by evidence in terms of application. We're restricting ourselves based on evidence in terms of claim. If we make a claim not based by evidence, we can be doing harm. However, we're essentially trial and erroring at the best of times with our patients. I have pain when I lift my arm. Okay, well, let's see what different directions you can lift it in. Okay, let's see if I help lift it, does it help you? If I give you more resistance, does it help you? If I have you lift this thing, does it help you? If I poke here, does it help you? And we kind of troubleshoot. Troubleshooting is valid. Claims demand evidence. It's that simple. Thanks kindly. I hope you have a great day.